Have you ever felt like using the nutrition care process and the nutrition care process terminology is time consuming? Or it makes your notes too long and no one even reads them? Hi, my name is Amber Porter, and I'm a dietitian with the Veterans Health Administration. I'll be sharing some great tips to save time in documenting your M&T services using the NCP Quest tool. The Nutrition Care Process and Terminology Query and Evaluation Support Tool, otherwise known as NCP Quest, is a tool used to standardize and streamline your documentation. This tool contains the pertinent information you need in your notes. Using this tool can help you develop succinct yet high-quality M&T notes that are easy to read. The NCP Quest tool is divided into the various sections of ADIME: assessment, diagnosis, intervention, monitoring, and evaluation. The nutrition assessment section consists of 4 parts. First, your notes must show documentation of assessment data that is outside of accepted standards, recommendations, and/or goals. Next, you should use comparative standards that are essential to the nutrition diagnosis when applicable. The third point is to have measurable assessment data that provides evidence that a nutrition diagnosis is present. And finally, the assessment data must be succinct and relevant. Let's look at this example. This is an M&T note for an initial assessment. Let's see if it meets the 4 points we previously mentioned. The first part of this note states some basic characteristics, such as age, sex, medical diagnosis. If you are a private practice dietitian, you may want to include these, as they will help you when you're filing for reimbursement. However, if you work in the hospital or a bigger institution where your notes are part of the patient's chart, which already states sex, age, and medical diagnosis, then you can eliminate this information from your M&T note. Next, including the nutritionally relevant past medical history will help when you are filing for reimbursement. Under food and nutrition-related history, the note clearly shows documentation of assessment data that is outside of accepted standards. The writer used comparative standards that are measurable and could help in writing a nutrition diagnosis. Finally, the assessment data is succinct and relevant. The RD did not write out the entire diet recall or include irrelevant labs. Next, we have the nutrition diagnosis, which also has 4 requirements. First, state the problem using standardized terminology. Next, mention the etiology, which is the root cause of the nutrition diagnosis that a nutrition provider can resolve or mitigate. You must also indicate the etiology matrix category. And finally, list signs and symptoms, which provide evidence that the nutrition diagnosis exists. Let's take a look at our example. The PES statement is altered nutrition-related laboratory values, phosphorus, related to kidney dysfunction, physiologic metabolic etiology, and food and nutrition-related knowledge deficit, knowledge etiology, as evidenced by hyperphosphatemia and consumes high phosphorus foods per patient's diet history. The problem is stated using standardized terminology. Next, the etiology is listed, which again is the root cause of the nutrition diagnosis that a nutrition provider can resolve or mitigate. Then, the etiology matrix category is indicated in parentheses. And finally, the signs and symptoms are listed, which provide the evidence that the nutrition diagnosis exists. The next section of the tool is the nutrition intervention, which has 6 requirements to address in your notes. First, each nutrition intervention needs to have an action consistent with the goals of care. You will need to write a nutrition prescription. Next, you will need to direct the nutrition intervention to resolve the etiology and/or improve the signs and symptoms. There should be at least one nutrition intervention for each etiology listed in the PES statement. You will need to use standardized terminology to document the nutrition intervention. And finally, your documents must specify a reassessment plan and timeline. In this example, the nutrition prescription is stated, which includes the RD's diet recommendations, as well as the provision of adaptive eating utensils at each meal. Nutrition education was provided to the patient. The topic discussed was high phosphorus foods to avoid or limit in his diet. The patient was provided a handout of high phosphorus foods from the Nutrition Care Manual. There were no barriers identified to learning. Another part of the intervention was coordination of care by the nutrition professional. The RD contacted nursing about the need for adaptive utensils at the patient's meals. Finally, for your nutrition monitoring and evaluation, you will need to use standardized terminology to document indicators that reflect the signs and symptoms to monitor upon reassessment. Your note must have specific criteria for each indicator. In this example, phosphorus, which is part of the nutrition care process terminology, is listed as a lab value to monitor, with the specific goal of being within normal limits at next review. You will also be monitoring the nutrition knowledge of the individual client, which is also part of the nutrition care process terminology, with the specific goal of the patient being able to list 2 high phosphorus foods to avoid. Follow-up is listed for 1 to 2 weeks. This example fulfills all the requirements listed on the NCP Quest tool. If you are creating a note template for initial assessments, you only need the nutrition assessment through the nutrition monitoring sections. If you are using this as an auditing tool, the RT gets an extra point for using the terminologies and for having a follow-up note in the chart, if applicable. Here's the full note for the example that we used. The note is succinct, uses NCPT, and with practice, it can take less than 15 minutes to complete. Reassessments or follow-up notes are even simpler and shorter. All you need is to restate the nutrition diagnosis and the reassessment documentation, address the status of the nutrition diagnosis using standardized terminology, document the intervention success or barriers to implementation, as well as reasons for delay in the application of each intervention, evaluate the goals. That is the section of the interventions that were established at the last visit using standardized terminology such as goal achieved or goal not achieved. And finally, document the effectiveness of each nutrition intervention or modify the nutrition intervention when there is no evidence that the intervention has been effective. I hope this brief overview of the NCP Quest tool helps with making your notes shorter and less time consuming. With practice, you will become familiar with the terminology, and it will take you less time to complete a note. Just remember to use the NCP Quest tool as a guide to what you need in your notes. Do not include lab values that are irrelevant to your PES statement. Also, there is no need to list all of the patient's medical diagnoses or other impertinent information, which can make notes hard to follow. Thank you for your time.